Hey everyone, this revision video is going to cover everything you need to know for the psychology GCSE about addiction. Quite a lot to get through, so it could be quite a long video, so let's just get stuck in with it. Things that you need to know about addiction are the characteristics of addiction, the biological explanation of addiction and psychological explanation of addiction. Basically, where does addiction come from? And you need to know two treatments for addiction, which are aversion therapy and self-management programs. So let's start with some keywords and the characteristics of addiction. So firstly, addiction, what exactly is it? Well, it's a mental health problem where a person's repeated behaviour results in them becoming entirely focused on a behaviour or a substance, and often it leads to them depending on that substance. So that keyword dependence essentially means, due to their repeated use of a substance, it results in a person needing that substance to function normally. But it's worth knowing that we often associate addictions in very negative, bad ways, but they can happen as a result of something like a person who's got a really bad knee needing their pain medication to feel that they're not in too much pain to be able to leave the house. Other words that you really need to know for the exam are substance misuse and substance abuse. So misuse is when you use a substance in the wrong way or more than recommended. So for example, it might be someone taking more sleeping pills because they're really struggling to sleep, more sleeping pills than the doctor has told them to, or it could be drinking too much alcohol. Substance abuse is when someone uses a substance or drug in a harmful or dangerous way to experience an altered state. So for example, someone who chooses to smoke cannabis to get high. Now in the exam they might not use the word addiction, they might use the word dependence syndrome. Essentially all you need to know is that they are the same thing in terms of the psychology GCSE. Now there are 6 main symptoms, characteristics of dependent syndrome, and again you could get asked for them in the exam. So what are they? So firstly, it is a strong desire to use the substance, so always wanting to take the substance, whatever it is that you're addicted to. Persisting despite harm, so you know that what you're doing is hurting you, but you continue to do it. That's a clear sign of an addiction. Difficulty in controlling use, so you're doing this addiction, this substance, really, unusual times, unusual places, difficult, you're struggling to control it. You give a higher priority to the substance, so it becomes more important than the most important thing. It's more important than your family, than your friends, than your job. You might have withdrawal symptoms. So if you don't have the substance for a while, you might get tremors, hallucinations, etc., etc. And finally, evidence of tolerance. So tolerance means you get used to the substance, so it stops having an effect on you. So you find that you need to increase the amount or dosage of the substance, and obviously this is just going to make the addiction even worse. In terms of what a psychiatrist would be looking at, they'd be typically looking at 3 or more of these symptoms to diagnose someone with addiction or dependent syndrome. Right, let's get straight into the explanations of where addiction comes from. Firstly, we have the biological explanation. In short, the biological explanation says that addictions are moderately inherited. Let's try and explain that in just a little bit more detail. Basically, when you're born, your parents pass on their genes, their DNA to you. And there is a large body of research out there that suggests essentially if your parents are addicted to something or have an addictive personality, for example, then you may well be born with a genetic vulnerability to addictions as well. So essentially there is a chance you could become addicted to a substance. This doesn't mean that there's necessarily an addiction gene. It does not mean that you are going to become addicted to something. It just means that you are at risk, you're vulnerable, you should be aware of it, and it is definitely worth knowing. Now, the research that you could get asked in the exam is from that of Cage, who did some research into the alcohol abuse in Swedish twins. So let's have a little look at what Cage did. So Cage wanted to see if alcoholism was indeed influenced by hereditary factors. And what Cage did is collected 384 male twins from Sweden. It's a very specific sample, which makes evaluating so easy. He investigated if the twins were on the public register of alcohol abusers, and he also interviewed the twins as well. Now, whenever we're looking at twin studies, we're looking for concordance rates, aren't we? And if you have a high concordance rates in your monozygotic identical twins, then we're going to have a strong basis to say that there is a genetic link or a genetic basis for that behaviour. So, did alcoholism have a genetic basis? Yes, it did. So your monozygotic twins had a 61% concordance rate, which means in 61% of cases, both twins were on the alcohol register and had difficulties with alcoholism. In the non-identical dizygotic twins, we only had a 39% concordance rate. So clearly a higher concordance rate in monozygotic gives us a strong basis for a genetic link, a genetic explanation for alcoholism. Addiction of alcoholism can be inherited. So conclusion-wise, alcoholism is related to genetics and hereditary factors. So that's your base study, so you could get asked to outline that study. Now, normally you get the follow-up question to evaluate it. There's a lot there that you could hopefully pick out, but let's just run through some easy evaluations that you could have. So firstly, how was the information collected? Well, we used self-report, we used interviews, and we know that this is an issue because people can lie through the whole interview process. So we don't know how much of the information that they were giving was true. Was it genuine? Were they making things up? How many addictions did they study, and does this give us any concerns? Well, they only studied alcoholism, so can I say that nicotine addiction is inherited? No, I can't. So I've got issues generalizing the results to other addictions. You should be able to pull out issues with the sample. It's a really limited sample, only twins, only males, and they're only from Sweden. This is a big generalizable problem, representative issues. A nice easy evaluation for you there. Next one says, why do we know that addiction is not purely genetic from this data? Well, you've not got 100% concordance rate. If it was definitely just genetic, then all the monozygotic twins would be addicted, but they weren't. So there must be other factors that impact alcoholism. So, we can't just say that alcoholism is purely genetic. The data is reliable, so you should be able to, from that, determine what's happened. Other studies have followed up and they have found the same thing, suggesting it's a reliable idea that alcoholism could have a genetic basis. Now, what I've got for you here, guys, I'm not going to read through it, but I've put together a little bit of a model answer for a pretty tricky 9-marker. Would get you quite a high score, I believe. So again, this is something that you can pause the video on. I'm not going to read you through it. And you can make some notes and have a look at how a 9-mark answer might look for this type of question. Right, let's talk about psychology. So the psychological explanation of addiction comes down to the idea of peer influence. So peers being your friends and how your friends influence your behaviour. So the psychological approach basically says that you become addicted to something because your friends influence you to do it, and there's a bit of a psychological process for that. So essentially, we will observe our friends doing something and we will imitate them, we will copy them and conform to what it is whatever it is they're doing, and that's often just because we like to be liked. You know, we want to be popular, we want to have friends, we want people to like us. And the easiest way to do that is to look at what other people are doing and do what they are doing. It's called conformity, and I've done a previous video all about conformity and ASH and why we conform. So, you know, the idea of conforming to an addiction makes perfect sense. You know, you see your friends or people you want to be friends with doing something, an addictive behavior like smoking or drinking alcohol. You want to be their friend, so you imitate and you conform, you know, especially if that is rewarded. So you might get rewarded for copying them because you want to be part of that group, you want to have a social identity and belong to that group. So, you know, basic example, you observe a group of friends smoking, they're all laughing about it and being really nice to each other, so they know they're rewarding each other, and you want that as well, so you conform and you start smoking and they start treating you really nicely. So now you are part of that social identity, you're part of that group, and you're part of that group of friends who smoke all of the time. Now, the problem there is every time you meet them, you're going to smoke because it's part of the friendship group's sort of behaviours, and then because that becomes a social norm, it gets repeated, and that repetition leads to the addiction. As we know, repeated use of a substance is what essentially creates that addiction. But in this case, the repeated use has come from being friends with certain people and having that peer influence. So here's a breakdown of essentially how it works. Let's say that you want to be friends with a certain group of people and they all smoke. So the first thing that happens is you observe them smoking. So you watch your peers doing that behavior. What you then do is you imitate, so you copy, you conform. So what that means is you pick up a cigarette and you smoke it. The third thing that happens is there's some sort of reward. Maybe they see you doing it and they say, "Oh, I didn't realise that you were cool like us," and now they basically have rewarded you. That feels really good for you. Now they invite you to being part of the group, so you now have a social identity, they've accepted us into the group, and now the problem is being part of that group. Every time you meet up, it's let's have a cigarette, let's make it a social norm, and now that behaviour becomes normal and repeated, and that repetition creates the addiction. Right, let's evaluate that idea. So when we're evaluating, we've got a couple of different ways that we can talk about this. Let's run through and decide if these are positive or negative. So lots of research evidence shows that substance use often starts during our teenage years, and peers whose friends use the substance are also more likely to use it as well. Okay, if most addictions start in your teenage years, that makes perfect sense because that's where a lot of peer pressure happens. Peer pressure kind of disappears when you get a bit older, and it's not really a thing when you're in primary school either, so it makes perfect sense. And also, if your friends use a substance, you're more likely to use it, so that's showing that peer pressure does increase addiction, so that's going to be positive, definitely. So we have evidence that supports the idea that your friends can influence you to become addicted. It doesn't fully explain why one person starts in the first place. Okay, so if your friend influences you to start something, why did that person start in the first place? Okay, maybe their friend did it. Okay, and their friend, where did they start the addiction? Did they have a friend? Eventually, we're going to get to someone somewhere who didn't have a friend, who was doing the addictive behavior, the addictive substance, but they still became addicted in the first place. So why did they become addicted? So clearly we've got an issue here. We don't know why the first person started the addiction in the first place. If your friend makes you and influences you, what about the very first person? Clearly we can't explain that. The explanation is incomplete. It ignores other factors such as genetics and personality. It is reductionist. If you ever see the word reductionist, you should be immediately thinking negative. It bases all addictions onto peer influence. It's ignoring other factors, not a good thing. Some people become addicted because they choose to be part of a peer group, not because they were pressured. Okay, so the whole idea is that your friends are pressuring you, but what if you didn't? What if you weren't feeling pressured? What if you just wanted to do it in the first place? You've made that decision, so clearly it's not the peer pressure, the peer influence that's done it. Right, I've also got here, guys, for you a bit of a model answer on explaining the peer influence process and linking it in with conformity as well. Again, I won't read it to you, it's a long enough video as it is, so you can pause it and have a look at that in your own time for your own revision. Right, let's talk about the treatments for addiction. Firstly, aversion therapy, one of my favourite treatments to talk about. It's just a really easy one. So it's an addiction treatment which makes the addict have this really horrible negative reaction to whatever it is that they are addicted to, and the whole idea is to build a negative association between the substance, with the substance. So some of the best examples are taking an emetic pill with alcohol that makes you vomit. So every time you have alcohol, you think you're going to be sick. So that should hopefully reduce the alcoholism. We could give an electric shock to somebody whenever they're doing something that they want to give up, eating fast food, gambling, and one that you may remember from childhood is putting bad tasting nail varnish on nails. So trying to get rid of that addiction of biting nails, we put on some bad tasting nail varnish, which is a negative reaction, tastes horrible, should hopefully stop that addiction. So if we remember how we drew that out in class, we drew it out a bit like this. So on the left here, you've got the addictive substance. In the middle, you've got the emetic pill. And on the right, you've got the outcome, that vomiting, that feeling of being sick. So we repeatedly pair the addicted substance with a horrible feeling, and hopefully it should slowly put us off of the addictive behavior. Does it work? Is it good? Let's have a talk about it. Aversion therapy evaluations. How many people complete the process and why? Not very many people. It's a really horrible process. It's unpleasant. It's not very nice. It involves pain. It involves throwing up. It's not very nice. So people often drop out. So if they drop out and they don't complete the process, do they get past their addiction? No, so it doesn't work. Also, it takes a really long time. Aversion therapy doesn't work after just one session. You need to be prepared for 8 to 10 sessions, probably more. So again, because it takes so long, patients drop out. If they drop out, they don't get better, so it's not working. The treatment occurs in a therapist's room. Why is this a problem? Well, we always talk in psychology about ecological validity. If you're doing the treatment in a therapist's room, that is not a natural environment. So if I'm addicted to alcohol, when I go home, I know that there's going to be no negative reaction. Or if I go to the pub, I know there's going to be no negative reaction. So I've got I've got low ecological validity here. Finally, any ethical concerns? Well, it's really harmful. It's quite painful, actually. It's so disgusting. So it often involves physical harm. So this is clearly breaking a very key ethic of harm, physical, psychological harm. We shouldn't do that to a patient. So as you can see, it's very negative. There's a lot of bad things about aversion therapy, but it's really easy to evaluate, which is good. Okay, finally, we need to talk about the second treatment that you could get asked about in your exam, and that is self-management programs. What are they? How do they work? And are they any good for addictions? Well, a self-management program, again, it kind of is what it says on the tin, really, isn't it? You're managing yourself. So you join a group of people who share the same problem as you, and you support each other to make the right choices. And these people tend to meet regularly. It's quite often like a weekly process, and they share problems. They learn that they're not alone. They can support each other and they can be there for each other. So best example is Alcoholics Anonymous, but there are other examples of things out there as well. Now, the most common one that you might get talked or asked about in the exam is the 12-step recovery program. As you can see on the right hand side, we have 12 steps. Good news, you don't need to know all 12 of those. We can break it down into just 3 main key points for you. But basically, what is it? So it's a very spiritual self-help idea based on 12 principles on the right hand side there, which should help you overcome an addiction. But let's break it right down into the main key points. I can give you 3 key points about this process. Firstly, if you're talking about the 12-step recovery program, because it's spiritual, you need to be able to say something like, it begins by surrendering to a higher power. So it's very religious, it's very spiritual, assuming that someone with a higher power, an almighty being, God, is going to support you and guide you through your recovery. The next thing you need to be able to talk about is how this process requires the patient to admit guilt. That means talking to the people that they've hurt in the past, trying to fix those relationships that have broken down, going back and apologizing to people that they've hurt in their past. And finally, these people on the 12-step recovery program need to be prepared for a lifelong process. So it teaches you skills that last forever, and you are essentially signing up to a group where you will be able to support others and get support from other people at all times of the day, all times of the night, for the rest of your life. It's not a psychologist's treatment for 10 weeks. It is a lifelong commitment that you're signing up to. It is a holistic approach because we are addressing lots of factors involved in the addictions. So we're not just looking at one thing here. We're going to, you're talking about the urges that a person is having, anything that's going on socially, anything that's happened in their past, anything that's happened in that last week that could be linking to the addiction. So it's a really supportive and holistic process. Is it any good? Evaluations. Well, there is no evidence that groups like Alcoholics Anonymous work any better than any other treatments. Clearly a negative, so it doesn't work in any better than anything else. It is a long-term commitment of a high dropout rate. Okay, again, high dropout rate, clearly a bad thing. We don't want a high dropout rates. We want people completing their treatments and getting better. If they're not getting better, it's not a very good treatment. It is a holistic approach as it considers lots of factors. Whenever you see the word holistic, you're thinking positive, really good process. It's not just focusing on one reason why we become addicted, it's focusing on lots of reasons. And finally, people are taught skills on how to cope, so it has good long-term effectiveness, as you can use your skills at any time. They also have support from other members whenever they need it. Look, if you've got skills for the future, if you spiral back down, if you relapse, if you get involved in another addiction, you have the skills to treat yourself. Is that a good thing? Of course it's a good thing. You can always go back to your training, what you've learnt in these self-management groups to really improve yourself. And also the fact that you've got support from members whenever you need it, that's also a really good thing. If you're feeling down, if you're feeling negative that you might relapse, you can phone somebody up and you can get their support. So for that reason, really good supportive treatment choice for addictions. Right guys, again, I know it was a bit of a long one here, but I've managed to get all of addiction summarised into this roughly 20-minute video. So that's a couple of weeks worth of learning, really summarised into just 20 minutes. What have we talked about in this video? We've gone through the key characteristics of addiction, the biological and psychological explanations, as well as your 2 main treatments, aversion therapy and self-management programs. Guys, make sure you're really confident with this topic, mental health, depression and addictions, and get ready to smash it for the exams. Till the next video.